My name is Melissa, and I'm 32 years old, and I live in the United States, and I'm currently 16 weeks pregnant. And I'd like to talk to you today about why the Natural Fertility Prescription is a great program, in my opinion, for any couple who is looking to have children. And I say that regardless of your history with fertility. If maybe this is your first pregnancy and you're looking just to see maybe the best chance to have a successful pregnancy, or if maybe you've suffered from infertility and are having trouble having your first pregnancy, or as in my case, you had a successful pregnancy, and when you went to try again, you encountered second infertility. So that's actually where my story begins. My husband and I decided to have a child in December of 2006, and we were blessed. We conceived our child quickly, and even though I had a difficult pregnancy, I was nauseous for the entire pregnancy, and I ended up getting gestational diabetes despite having no risk factors for it. The baby was never in danger. She was always fine, and she was born healthy, so I considered it a great success. And so a couple of years later, in August of 2009, we decided we were ready to try again, and again conceived right away. And that's when the problems began. We ended up having 2 miscarriages within 6 months, and I just wasn't expecting it after the success we had with the first pregnancy. And so what happened was, after the first miscarriage, the doctors say that's normal, it happens, and you find a lot of people have had miscarriages, so it's not uncommon. But after the second consecutive miscarriage, I just didn't think that was normal. And I thought, I just had this feeling something else is going on here. And I did all the workup, the tests, blood tests. They checked my uterus to make sure there was nothing in there that was causing a problem. And right around that same time, we ended up getting the results that the second miscarriage was caused by a chromosomal abnormality. It's called Turner syndrome. The baby was missing an X chromosome. And they say that most of the time that's due to the sperm not contributing the second X, and it's a very random thing, and it happens. And so all the doctors were telling me, just go for it again. Once I started my cycle and I was ovulating, just go for it. I just didn't think that was right. I just had this gut feeling that, 2 miscarriages, I don't know what caused the first one. To me, something was wrong somewhere. I had a feeling it had to do something with the egg or the sperm or our body. Something was wrong. And that's when I came across a tele-summit that Iva was actually one of the presenters. And that changed my whole concept of fertility, because all the presenters, especially Eva's presentation, was just awesome. And she talked about how to improve sperm quality, how to improve egg quality, just by simple lifestyle changes that didn't have to do with any drastic drug regimen or treatments from a medical professional in an office. It's just things you could do at home. And I really wasn't skeptical about any of the information that I heard, because I was already sort of thinking that something I was doing, or something my husband was doing, or something we weren't even doing consciously, something was affecting us in a way that was negatively affecting our fertility. And so for me, following the Natural Fertility Prescription wasn't hard. When you go through it, there's a list of things that are helpful for fertility and things that aren't, and the idea is to follow 80% of them for 4 months. And again, I think it's going to depend on your history with infertility, kind of where you are in the journey, depending on, how much time you've been struggling with it. But for me, 4 months wasn't anything. It wasn't hard for me to do at all, because I wanted to make sure I got it right this time. I did not want to have miscarriage number 3. And so one of the things that I would maybe caution is, a lot of times one of the 2 partners is more convinced about looking for alternatives. And like for me, my husband was very supportive, but he wasn't all that convinced. He just thought the doctors were right, and it was just bad luck. So that might be a little bit harder, but I found, just looking for a couple things for him was easy. Like I was just stunned by the whole idea of laptops and electromagnetic radiation and just how dangerous that is to fertility. And he just asked him, can you work on your laptop, not on your lap? And can you put your cell phone somewhere else besides the pocket right by your abdomen? Little things like that. And then, food, natural foods. Again, one of the partners usually in our case, it was me was more into that. So I just, took it upon myself to make sure that was what we had on hand. So little things like that I think can really help if, one of the partners is more into it. Vitamin supplements. My husband was really good about just taking the vitamin supplement that I asked him to take. And so I didn't think it was that difficult. So I really do think that this program is good for everybody, just because, it's a lifestyle change, but it's a lifestyle change that's good for even if you're not trying to have a baby, and I don't think it's very difficult. And I would say for those of you who are trying to decide where to go next, especially if you've had trouble, just to be encouraged, because, in my situation it worked well, just changing a couple things. I mean, I don't know how it's going to turn out, but I'm a lot further along than I was before, so I think it's a good sign. And one other thing that I would say is this program is very easy to use in tandem with the medical community. That's what I did, and Iva will teach you a lot about the whole reproductive process, and to go into a medical doctor with that knowledge, you can get so much more accomplished. Just like for me, I knew my progesterone was low because I'd read about checking it, so I asked the doctor to check it. I said, can we check my progesterone? We checked it. It was low. I said, can I take suppositories? I want to take them right after I ovulate to make sure that the baby can implant. Just this knowledge I had no idea to know about before. And it was just really helpful. And I found that the doctors, if you know what you're talking about, they will be very compliant with whatever you ask. And it's just helpful to know what you're looking for. When you get your test results, you know what the numbers are supposed to mean, because a lot of times doctors don't tell you what they're supposed to mean. So I think it's just a wonderful program to go in with knowledge, to work with your medical doctors as well, especially if people are skeptical about just doing things all natural. You don't have to just go one or the other. You can mix the two, and it's just a wonderful combination, I found. So anyway, I hope this was helpful. And again, I really recommend the Natural Fertility Prescription for any couple out there who's looking to have a healthy pregnancy.